Like, of course, I have Nursing Uncensored with me. I'm going to talk about hot topics all day, all night. But can we talk a little bit about race and gender,
Yeah.
like healthcare, right?
Mm-hmm.
So you have a patient. The patient says, "I would rather a male nurse," right? Or you have a patient that says, "I would rather a white nurse." Do you think those two things are the same?
No. Because I think that, for example, if a female says to me, I'd prefer not to have a male nurse, in my mind, I think, okay, I don't know if she has some kind of sexual trauma. I don't know if she has an abuse history, if she had, whatever. But for me, when it comes to race, like the color of your skin isn't affecting the care I'm providing you.
Right.
Like, and most often, I mean, there could be a situation where like someone say like, because I live in Iowa, we're a very white state. I come across racists all the time. And I've even had nurses, here's the thing. I'm going to risk sounding like a stupid white person here, but I follow Instagram accounts that are like, empower Black nurses,
Yes.
like we need our patients to look like our nurses. I don't think that means that all, like, if I have a Black patient that I'm assigning, I'm not going to be like, oh, you're a Black nurse, you'll talk. Maybe they don't get along. It's not like, oh, hey, you guys all, like, those racist attitudes need to die. But I think that we need to empower people to speak out. You have to be careful with patients because, your patient could be like watching Fox News and like preaching some horrible shit. And in that case, I say, hey, I don't feel that way. I really don't want to talk about that. Like, let's just stick to your medical care.
Yes.
But if I see someone like treating someone like shit, I think that my privilege I'm going different directions here. My privilege requires that if I think if they don't have a trauma, if there's not something legitimate happening there, that you're not going to get your racism catered to. It's the same way I've had patients say that they don't want the fat nurse back. They don't want the nurse with the accent back. They don't even want the float nurse back. They may be white, English speaking, just like the patient, but like, I'm sorry, you don't get to. I think that there's a fine line, but I have yet to meet someone who's like, I was beat up by a Black man that looked like you. I have PTSD for, like, that's not what's happening. People are just like, oh, you're my nurse? I don't cater to that shit. You're Indian, Mexican, white, Irish, Filipino. All those nurses are capable nurses. They're all licensed nurses. I'm sorry. I have a hard time with that. I
hear you. I mean, I think it's important to be said just because, I mean, there is an actual difference, right? Like if a female patient wants a female nurse, that's a legitimate claim, right? Like of course it makes sense. But when you talking about race, talking about if one of the nurses has a hijab on or a headscarf on and is saying,
that's like she's not cathing you with her hijab.
Yeah,
like,
right?
You don't have to touch it. You don't have to believe in it.
In fact, it'd be best if you wouldn't touch it, right?
Right.
Like, exactly.
Let's not don't ask, like, what's that? What are you? Why do you, like, it's cool if you have a patient that, like, wants to learn and understand. I'm not saying, like, cut those patients off. But I've even had patients that say to me, like, are you old enough to be holding my urinal? Yeah. Well, you know what? I fucking am. So do you need me to do it? Do you want me to spend 10 minutes looking for a dude that can help you? Because, like, he's busy and you can wait a while. You can hold your Like, I don't have tolerance for the racism shit. Yes. But it's the same way with, like I said, the whole I don't want a fat nurse. Well, really? Because she's a really good nurse. She knows these meds better than anyone. I go to bat for those people. I might not say, like, you're a racist and you're an asshole, but I might be thinking it.
You got to, like, but at some point you got to be like, look, this is it's inappropriate. Can we not do that? We can't do this. Like, you have to put your foot down at some point, right? At some point you got to put your foot down. But you also
have to get to the root of it. Like, is it because that particular nurse treated them badly? And they don't want that nurse back, and it has nothing to do with race. They just happen to have different races. But
oh yeah, because that shit
race
happens
is
all the time.
Race is a fucking social construct. It does. Yeah. And the same way that, like, white men are perceived as doctors, as white females are perceived as nurses, Black females, Black males are perceived as whatever support staff. Like, can you call my nurse? I am your nurse.
Yes, like, exactly.
So that shit I don't have tolerance for. However, I like to think of myself as being one of those people that any kind of injustice, I'd hope that I'd have the balls to speak up and say, like, we don't do that here. Like, we don't play that shit here. Like, we don't support those isms, whatever they are. But I think I see it most with racism because, like I said, I live in a primarily white, red state. Yeah. So it happens.
Living in a primarily white red state, with the presidential election going on, I you don't have to say if you're for Trump or for the Republican Party, but
I can decidedly say that I would get arrested if I told you my actual thoughts on Trump. So
okay,
I try not to go super political on the podcast, even though I think politics and healthcare are very tightly intertwined. I try not to get super political because I don't want to polarize my listeners who would otherwise benefit from my information.
Makes sense. But I don't take those heeds on this podcast. So please go away.
I'm a bleeding liberal, socialist, almost Marxist, like
like all the way on the left. You're all the way.
Kind of. I believe in. I'm not a libertarian, but I do believe in personal liberties. But I also believe that some people are so rooted in what they think is right and wrong that they would happily infringe upon the rights of others. And so I feel like, as a person with privilege, I think that if I don't do my part to say, like, no, your Asian nurse with the accent was totally right, and what she told you is totally true because her accent does not affect the way her brain works. Right. In fact, like, I've said it once to a patient who was being very verbally aggressive, and I said, they were like, well, I can't understand shit she's saying. Sorry, I shouldn't do the accent. I shouldn't mock people, but like, I can't, they say, like, I can't understand her. It's like, well, did you say, hey, I'm having trouble understanding you? Like, can you look at me when you're speaking? Or like, can you use a different word? These are just people that are like, no, I'm not going to try. It's like, well, they might have a hard time understanding you because guess what? They're so fucking smart that they're nursing in a language that's not their native tongue.
Exactly.
Could you learn Japanese and go be a nurse in Japan? No. Yes. Well, your Japanese is shitty. What you perceive as shitty English is actually really fucking good English because it's not their first language. Right. So, I mean, I'm never going to get aggressive with a patient like that. But if somebody's being an asshole about it and the nurse is not doing anything wrong, I'm going to say that.
It's just not allowed.
I had a patient that was like, she had a clogged feeding tube and she was trying to unclog it. She had all the right supplies. She had warm water. She had a small syringe. She had the clog busting shit that we use. Yeah. And the family, I walked in and she had been working on it for a while trying to get the clog out. I walked in and just by chance, I was able to get the clog out in like 30 seconds. And the patient family was like, oh, you fixed it? She's been working on it. And I said, well, I mean, she did all the right things. She has all the right supplies. And they were like, oh.
Yeah, it just takes some time, boo-boo. It's a clog. Sometimes it was dissolving. Exactly.
If your drain is clogged and the Drano doesn't work the first time, are you like,
oh my God, right?
Sue the company. No, like, give it a second. But I had to say, like, she's doing everything right. She just loosened the jar lid for me. That's all. And they were like, oh, really? So go to bat for those people. Like, instill those, especially if you are white and you're in a white community and you have white patients and our patients are old as shit. Sometimes they have different ideas, but you know what? I didn't know how to use a cell phone when I was a kid. I learned. You can adapt. You can learn.